Bulletproof Radio, a state of high performance.
I'm going to ask an inflammatory question here, and I'm going to preface it by saying anything that you do that makes your cells healthier is going to make you more resilient to everything. And the reason I'm prefacing it is now, do we have any data about Spermidine and COVID-19?
There was actually a study really pretty recently that came out on Spermidine and COVID-19.
Oh, wow.
And, and I don't want to, have this pulled off the air because, but.
We're not talking about treating, diagnosing, or curing any of that. We're just talking about being stronger. All right. So what did the study show?
So what it did was, again, improved remember what happens when there's a couple of things that happen when COVID goes awry. And one of the big things is we know there's this cytokine response, and that bad cytokine response, that these inflammatory cytokines start causing this cellular destruction. And that's why people go on to have cardiovascular damage and strokes and kidney damages, because now you've damaged the lining of the blood vessels because of these cytokines that have appeared in response to the COVID. And we know that Spermidine, again, we saw that in the osteoarthritis mouse study, is it markedly reduced a lot of the inflammatory cytokines that we see elevated, like tumor necrosis factor alpha and interleukin-6 and IL-6, right?
There you go. That's the one.
And it upregulated the M2 macrophages, which are your good anti-inflammatory macrophages that help get rid of bad things. The other thing it could be used for is, again, remember that to form a normal immune response, to have normal immune surveillance, is that you basically have to have this balance between the anti-inflammatory and pro-inflammatory side of our immune system. And so if somebody's so inclined to get vaccines, well, this is going to definitely enhance the vaccine efficacy as well, because you're going to be able to respond in a much more appropriate fashion to somebody interested in putting a new antibody into you.
Could it maybe lower risk as well? I know this is entirely hypothetical.
I think it's definitely going to lower risk, because when you get your body into an immune healthy state, as we all know, that's why higher dose vitamin, anything that gets our body to an immune healthy state is going to make us a lot less likely to get COVID and get sick. So if I have lower reactive oxygen species, it's why obesity is a risk factor. It's why, cardiovascular disease is a risk factor, because those guys have very high levels of reactive oxygen species. Their bodies are in a very poor state to recover. So you get some little infection and you have a horrible outcome. So by downregulating the reactive oxygen species, upregulating the anti-inflammatory macrophages, the M2 side, reducing the inflammatory cytokines like IL-6 and TNF alpha, you're in a perfect state to be able to fight this disease or not get it at all. I'm not very afraid of getting COVID. I do all sorts of things to keep my immune system healthy. And, I think that unfortunately we're focusing so much on isolating ourselves and, and everything and not just getting healthy.
But if you're not afraid, you're not a good person. Just remember that.
Yeah, you're right.
Sorry, you have to look at your individual risk, not average risk and all that kind of stuff. But we don't have to get all political. Wait, I thought this was science. Never mind. We won't even go there. But I appreciate you saying that you don't have a high degree of personal fear there, because that's a refreshing message.
I wear my mask and I'm careful around the people, but I do think, and you've pushed this, it all comes down to people have got to start taking some responsibility for their own health. And, it's like I said, before Spermidine ever makes it before your doctor ever recommends Spermidine to you, it's going to be, 10, 20 years, maybe, maybe never.
No, it's going to happen. I'm doing my job. My job is to make the stuff no one knows about happen faster.
Right. So. And that's our goal too. Boulder Longevity Institute, we have a whole, what we call Human Optimization Academy. Our goal is to teach the people, because you've got, and that's why I love your, people like you who are out there spreading this stuff, because if you rely on somebody, a doctor to tell it to you, or the drug company to bring you something, you're going to be way behind in terms of treatment. So you need to learn these things. You need to understand these things.